Welcome, everyone. Good morning. My name is Stephen Collins. I'm the CEO of Matter. Today, I am delighted to present a program that we have developed together with one of our member companies, Sentio Solutions, which is they're the makers of Feel. Feel, which you'll learn more about, is a comprehensive mental health solution that combines three key elements: real-life data from a proprietary wearable sensor, evidence-based techniques to use that data to quantify a person's emotional state, and connections to care providers and real-time support. Their solution has become increasingly important in our current environment, where we have seen more people struggle with mental health and well-being as a result of the pandemic. And at the same time, we're seeing accelerated adoption of digital and remote solutions to enable health and resiliency. And we have a terrific team to help us dig into these issues today. So first, we have the co-founder and CEO of Sentio Solutions, George Eleftheriou. George has a background in management consulting and analytics. He has 3 master's degrees and started the company about 5 years ago. Next, we have Deb Smolensky. She is the Global Wellbeing and Engagement Practice Leader for NFP, which is one of the largest insurance brokerage and consulting firms. In addition to that role, she also holds a key role with NFP Ventures, the firm's strategic venture arm, where she focuses on insurtech, fintech, and digital health verticals. And finally, we have Dr. Alan Spiro. Until recently, Alan was Chief Medical Officer for Blue Health Intelligence. Prior to that, he's held senior roles with large insurers, brokers. He's co-founded a company called Accolade, which many people may be familiar with. He's held numerous leadership and advisory positions with startup and growth stage companies, and is a general kind of healthcare guru in Chicago and around the country. I will be guiding the conversation with the panelists. If you have questions you'd like to ask, please use the chat function, and I will incorporate them as best I can throughout the conversation, or at the end. We'll make sure we have plenty of time for audience questions. So with that, let's jump into the conversation. George, I want to start with you on a topic of kind of what's the current state of workplace mental health and well-being, and you've actually been able to quantify and measure something that a lot of people have been talking about, which is the toll that COVID-19 has taken on mental health, both in the workplace and in life. And I know you've got some fascinating data to share, but I'll turn it over to you and help us understand what it is that you're seeing.
Absolutely, Stephen. Many thanks for hosting us in today's event. Actually, even before COVID-19, we were, as a country, we were suffering from a significant mental health epidemic. I would say 1 out of 5 individuals were suffering from depression or anxiety in the US, and this had a significant toll in the workplace as well, a significant toll in productivity, not to mention the healthcare costs associated to those disorders. But what has happened after COVID-19 is things getting much worse. And if you don't mind, I will share a few data points that we have seen from different studies over the past few months. So, and those are qualitative studies, but as you mentioned, we have some quantitative data to share for the very first time. So we saw that, and probably this will not come as a surprise to any of you, that more than half of adults in the United States reported that their mental health was significantly impacted because of COVID-19. And this had to do in many cases because of uncertainty related to finances. It could be related to stress related to COVID in particular. But what was a common theme was that Americans are experiencing symptoms of stress, depression, and anxiety in a much higher rate. So while before the pandemic, we saw 1 out of 5 people experiencing those symptoms, after the pandemic happened, we saw an increase of 33% basically. So over 30% of people in our country struggle with those conditions or report that are struggling with those conditions. Of course, we have to account for many more that don't report that or are not aware of those symptoms. Uh, this means that 100 million people in the US right now are expressing symptoms related to depression and anxiety. And out of those 100 million individuals, only 1 out of 3 has access to mental health support. Again, this has not changed significantly since the past. It's just that demand has spiked significantly, and that's definitely has a toll in the field, in the workplace as well. A staggering statistic, though, that I wanted to share with you in order to realize the magnitude of that epidemic is the number of people that reported having suicidal thoughts in May. May was one of the very first months of that people quarantined and of the lockdown. And we saw 21,000 people reporting that they had suicidal thoughts. And just to put things into perspective, the number of deaths in May was close to 20,000 as well. So 20,000 people died because of COVID-19, and another 20,000 people were actually contemplating harming themselves because of the mental effect of COVID-19. So this pandemic definitely has a significant impact into our mental health in the country. And this also is something that we see in the workplace. We see over 90% of employees being concerned about COVID-19. I'm surprised, to be honest, that this number is not 100%. We see that 60% of employees believe that their employer is responsible to provide them with mental and emotional support tools. And one encouraging statistic is the fact that people have started expressing more and talking more about their mental health struggles. This is very important because this is the first step that we needed in order to tackle the stigma that exists in the field of mental health. So there is no question around the effect of mental health into productivity, into presenteeism, absenteeism, and obviously this increased prevalence of mental conditions affects all those metrics in the workplace, especially as we now move into a working from home model, working remotely. This is even worse because people don't have access to any support when they are actually experiencing those conditions and they're all alone in their home office. And it's even harder for them to raise their hand and say, I need help. So those were the data that we saw from a variety of different qualitative studies that happened over the past few months. But what is really different in the field of mental health compared to any other medical field is that until now we rely on qualitative data in order to extract insights about how mental health affects our lives. And since recently that was the case, through the introduction of technologies like the ones that we bring to the market that help us quantify mental health, we now have some quantifiable data that showcase exactly this, the impact of COVID-19 into the mental health of employees and Americans as a whole. So just as a very quick background, what we are doing is providing a holistic, data-driven digital therapeutic program for mental well-being and mental health. targeting both stress, depression, and anxiety. And the cornerstone of our solution is the continuous monitoring that we bring through our proprietary device. So through a wearable sensor, we are able for the very first time to detect how someone feels 24/7, and then based on that objective set of data, provide them with digital interventions in real time, and at the same time take that data to their psychotherapist, to their mental health coach, to provide them with support. So what we did when the first quarantines happened, when the lockdown happened in the US in April, we started monitoring how the emotional state that we were monitoring through our device of individuals that were part of our program before COVID-19, before the quarantine, and what that looked like after the quarantine. So we analyzed over close to 1,000 significant emotional moments that we picked up through our device in both US and Europe. Millions of data samples from sensors that are very highly correlated with emotional activity, like electrodermal activity or heart rate variability or skin temperature. All those things that we experience in our body changing when we're experiencing an emotion, and probably we all have felt that, how our heart is pounding faster when we're angry, or how we sweat when we are stressed. So we monitor those data points through our device, and what we saw was very, very interesting. So this is what the emotional space looked like just before COVID happened. So we saw an even split of positive and negative emotions to individuals that were participating in our program. And you will see here on the vertical axis the intensity of those emotions, and on the horizontal axis you will see how if those emotions were negative or positive. When COVID happened, we saw a significant shift of the whole emotional space. So from having an even split of negative and positive emotions, we saw a significant move, a significant shift towards more negative emotions and much more intense negative emotions as well. That was the very first time that we were able, through a quantifiable way, to see the effect of COVID-19 into our mental health. And a few insights from those data points was that, as I mentioned, the negative moments were much more intense. While before we saw that only 30% of those moments were high intensity, as we have a high intensity scale of over 7, between 7 and 10. Now we see double that. So 60% of the emotional moments are very high intensity negative moments. And also we saw a significant change in the engagement of users with the program. So although people were experiencing much more negative and much more intense emotions, we saw them interacting much more with our application. And the reason for that was because they needed more support. So their engagement over the first few weeks of pandemic actually also doubled, and the people were requesting much more support. And this relates and makes a lot of sense when we take a look at the qualitative data that we discussed at the beginning. So that was a little more that I wanted to share regarding what we saw from our sensors during this transition from life as we knew it before and life with COVID-19. And I think that this is a very good, this highlights the importance of providing those mental health and mental well-being solutions to employees today, because otherwise we will see those negative emotions turning into depression, into severe depression, and then those conditions are much harder to tackle. Stephen, I think you are muted.
Sorry, I've been having little internet issues. Seems to be working for now. But George, it's fascinating data that you presented. I mean, it could just be me, but I've never seen this sort of quantified sort of emotional health and well-being quantified in the way that you're able to detail it. Can you talk? And I'm sorry if you addressed this while I was out. Just say so. But can you just say a little bit about how it is that you're able to kind of derive those insights from the parameters? Like, where does the research come from that allows you to make these conclusions about how somebody is feeling?
Oh, you're muted now.
Apologies for that. Thank you, Deb. Basically, I mentioned before that we all have experienced how our bodies respond to our emotional experiences. We have noticed how we sweat when we are stressed, or how our heart is pounding faster when we are angry, how our skin temperature is changing. So in the mid-90s in MIT, they published the first few peer-reviewed studies that actually correlated. They were proving the correlation between those changes in the physiology with the emotional activity of the user. So this is something that has been researched over the past 20, 25 years. But we are the first ones that bring that into the real world. And I think that because of the accessibility that we have to sensors today, the access that we have to the data science techniques and machine learning gives us a unique opportunity now to take those principles and bring it into the real world. What we're doing is not very different from what they were doing at MIT in the mid-90s. We are monitoring the response of the autonomic nervous system of individuals, and through that we can detect how they feel in different moments of their day. But just one point that I wanted to make here is that this would be worthless unless we connected that data point, that insight, with the right level of intervention, and unless we provided the protocol and the advice to the user, right? If we tell someone that right now we see that you are stressed, this could help them develop some emotional awareness, but it can be much more impactful when you guide the individual into a personalized exercise or into a personalized advice. So imagine next time you are angry, your device vibrates, and from your phone we ask you to do a breathing exercise.
Yeah, just to say, like, I thought this was a personal like test because I'm wearing my feel, and my moderator Stephen went offline and we're asked to just kind of run it. And my heart rate right now is like boom, 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 right? And so I got this little indicator. I'm like, oh, right. So here you might see me just breathing deeply and logging this in. I thought you all tested me. So good job there, Steve.
That's what it was. I faked a brief internet outage just to have a real-time test of the solution, and we'll show your specific data in a few minutes as to how you moved on the axis through the quadrants. Alan, you have a kind of a wide aperture view, and how have you seen COVID-19 improve awareness and understanding of workplace mental health? I mean, mental health has been something that kind of employers have talked about for a long time. I think every employer has an EAP program. The utilization of those, I think we could talk about or discuss. But it seems like there was maybe some trend before COVID towards a kind of different type of services and solutions among employers, but that since COVID, we've really seen quite a change. What have you seen?
Well, it's funny. There's always been a problem in mental health provision of care in terms of when you do talk therapy, a therapist of any sort can't manage at any one time too many patients. average, if you're a fully functioning therapist, is around 200 patients um, in your panel. That compares to 2,000 for an internist, for example. So that's always been a workforce problem. And in many ways, we've tried to get around that with medication management as being a primary modality. Um, and now we're just starting to learn that there are certain tools we can use, whether they're app tools, whether they're monitoring tools, that can really impact this tremendously, make mental health services more available. But also, mental health is a continuum. And there's adverse emotions and issues of resiliency that's considered the wellness space. And then there's overt depression, bipolar disease, et cetera, in the mental health space. But it's really just a continuum. So the question here is, how do you broaden that look? And now you have COVID on top of it, where we started out with the COVID being a work from home, and people soon realized that rather than work from home, it's live at work. It's been very, very difficult for people to separate themselves. They're working actually longer hours very often. There's also the stress of those who have the kind of jobs that have to bring them into the public view. And they're now not only scared about losing their jobs, but they're scared about dying. So you have this perfect storm, if I can put it that way, of a mental health emergency that is just starting, because there's always a lag between the physical and the emotional, if I can put it that way. So we're just starting to get the wave of this starting. I fear for more suicides, et cetera, and there's a lot already. It's a major health problem. So the idea of being able to have something to help people monitor this and also to quantify the problem, which from a public health point of view, you first have to do, is very exciting to me.
Yeah, the quantification aspect of it from public health point of view is really fascinating, and to think about the implications going forward. And I know, Alan, there are other ways to quantify it that involve measuring certain, through certain blood tests. But from a practicality point of view, the implications of being able to measure large numbers of people or the right people in what's essentially a non-intrusive way seems to me to be pretty significant.
It is, and it is, and I know George likes to make the point that it's no different than glucose monitoring and wearing a CGM, a continuous glucose monitor, for people with diabetes, for example. And I actually don't have diabetes, but I wore one recently for another company I'm involved in, and it's amazing the insights you get. And in that same way, the My Field device can give you tremendous self-insights, but also can create this real-time monitoring. We're in a very interesting era in healthcare where we're now, because of COVID, really starting to, for example, pay for remote patient monitoring. Federal government now pays for that under certain circumstances. And that's only since the COVID era, really, when we're paying for telemedicine in different ways. So there are all kinds of implications. The technology has been there, but now because of this pandemic, we're seeing the regulatory agencies and culture catching up with the technology. And this idea of a wearable for mental health and for emotions is right in keeping with other types of wearables, and it's extremely exciting, and potential is vast.
Yeah. Yeah, Deb, let me turn to you. Your NFP works with, I don't know how many employers, but a whole lot. And how have you, the initial response to COVID-19, if I think back to what the conversations were like in March in the US, there was really a crisis mentality, and everybody was trying to figure out, what's going to happen, whether they're employers and health insurance companies, doctors and providers and schools and everybody. And now we're 8+ months into this. How has that initial crisis response evolved and And are you seeing new kind of frameworks being adopted related to mental health and well-being? Are employers looking at kind of mental health and well-being differently or more fundamentally as part of their culture and part of their workplace and part of their offerings? What are you seeing?
Yeah, I mean, you've hit the nail on the head, right? We went from crisis and we're still in crisis. So we went from a long-term view to like laser focused, and mental health rose to the top and continues to rise to the top. And part of it is, I think 100% of us, even though and George said this too, his slide said 90% from that survey, but really 100% of all employees have experienced some type of COVID mental health symptom. And we've never had that in our employee population or workforce where everyone can relate to this condition. And what that has done is opened up the conversation to CEOs, the leaders, the decision makers, to see how important it is. And that's usually where solutions start. So this has risen to the top. And so in terms of expanded frameworks, the main thing is, by no means is mental health just an EAP. So we are really looking for more robust solutions, making sure that the virtual telebehavioral can be accessed. And most importantly, that it goes beyond your employees that are just on the health plan, right? That is a framework change. It's for all employees to have access to the care. And then to your point, Stephen, I think it's expanded in ways that we didn't predict and accelerated in terms of mental health alone, the care, the quality, and the cost around mental health conditions has risen to the top, but so has the need and realization for mental well-being. So to Alan's point, that continuum has now become part of an integral framework. And I guess I just want to make the point that it's rare that one solution makes it and solves for both pillars. So employers' framework now has expanded to look at mental health and mental well-being. And then finally, it's even broadened, if you think about it, in the mental well-being aspect beyond resilience, burnout, fatigue, to tangible things like parenting with kids at home. And so that definition of mental well-being and that framework has broadened as well.
And all of that under the kind of auspices of how employers are thinking of the health of their employee populations.
Absolutely, absolutely, that's true.
So if you think about the future state, kind of what is the role of digital solutions like Feel to kind of helping employers take a more holistic approach? Deb, what are practical steps that employers can take today? And then I'll ask you kind of what you think that's going to look like in, pick a time frame, 3 years out, 5 years out, something where some period of time in the future where something like Feel isn't quite as amazing as it is right now, because it's something that people expect to be able, technology to be able to do.
Yeah, so I'm representing the employer space with a lens of the future, as you mentioned, in the startup space, which gets me super excited. So I have to live in the theoretical and the future and bring it down to tactical and practical. So to your point, Stephen, I think right now what we're seeing is the start here moment is realizing honestly that there is a difference between mental health and what your EAP and your telebehavioral can do. That's episodic care more so than start here by adding mental well-being and skill building. It's a skill. If we can just focus on that message alone in 2021 and adding those opportunities for skill building through the technology, like feel, like even brain training in terms of the digital apps, like Insight Timer and Calm and those kinds of things. We have to help people realize there is that skill building aspect, and you use technology in service to the humans, right? So it's just, how do you train the brain in an easy way to really rewire for optimism, growth mindset, and those kinds of aspects. I mean, in the future, it would be my dream, as we were talking a little earlier, to really have people understand just the awareness, the self-awareness going on. Because once you're aware of what you're experiencing, you can change. You can bring your computer back online to make the right decisions. It's just a skill set that we have never been trained on. And so the technology I'm looking forward to is those kind of feel apps that tell us what's going on a real-time basis. The VR, going into a space, or binaural beats that really go into the brain waves and change that neurobiology at the moment. I'm looking forward to the future when we are all more aware and showing up with more empathy, more gratitude, and more resilience.
I mean, me too. And with what the country's going through these days, it just seems so important that we figure out a way to get there. And if employers can be a part of that solution, that, would be all the better. Alan, let me ask you, when we were talking earlier, you mentioned some concerns potentially about privacy and how employers need to think about this data, and how people need to think about this data as it increasingly becomes possible to collect and analyze and quantify and measure things like somebody's emotional well-being. And what are the implications for employers as they consider solutions like this that really represent another frontier of how technology can be used to shed light on health conditions of individuals, and as Deb was indicating, really indicate a path forward to help people manage and become more aware and become healthier. But there's another potential consideration as well.
And there is. This has an ethical component to this. It scares me in many ways. Once you have wearables that reflect emotions, that reflect in some ways what people are feeling, those wearables can be hacked. They can be listened in on, so to speak. The data can be used in ways that are unethical. Are we going to use them to decide whether or not someone's too excitable to be hired for a job? Are we going to use them to decide if someone needs to be fired? You can see these in a very positive light, and I tend to be an optimist. But you have to guard against misuse, like in anything else. We're getting attuned to the fact that knowing people's genome, knowing their genetic signature, so to speak, can be very helpful and can be very interesting, but that has to be very private and protected. This is no different. This really is no different, and we have to think about it in the same type of terms and make sure we have guardrails up.
Yeah, I'm glad you brought up the genome, because I think what we're seeing is very powerful technologies or that are becoming prevalent, becoming part of our lives, that can reveal things that historically were just not used to being revealed. And the implications of that are really interesting, both from how do we, there's so much opportunity that these solutions can be used to help people, and then by malevolent actors or gray areas, there are challenges to be considered.
That's right.
George, what do you think? You're obviously squarely in the center of all of this. What do you speak a little bit about the future and the role of real-time data in offering personalized solutions and predictive capabilities, and what does that look like as an employee, as a person, when I wake up in the morning? What's going to be different?
That's a great question, Stephen. Just before getting to that, let me just add to what you were discussing before with Alan. And basically, I very much share the concerns that Alan mentioned before. To be honest, what scares us the most is what could happen, to the data that we have if something changes drastically. And that's one of the reasons why we have decided not to have access to any personal information, or not to be able to connect the dots. But the only place where the dots are connected is in the phone of the user, basically. So we even store the ID of the person and their emotional data even in different physical spaces, to make sure that it's really almost impossible to hack that. Uh, but I agree. When there is a significant innovation, significant change, there are concerns. If 20 years ago someone told us that Google or Apple would know from our GPS data where we are 24/7, probably this would scare us out. But in many cases, because we want to have personalized recommendations of which cafeteria to go to or which restaurant to visit, based on our location, we enable that data. So what we have seen is that the level of trust obviously needs a lot of attention and needs a lot of effort to build. But at the end of the day, the personalization that those type of data points can give us is very significant. And going to back to your question, this personalized support and this personalized experience that actually transforms psychotherapy or mental well-being or mental health practices into real life of individual is how we envision the future. So right now, the current paradigm is very fragmented. Right now, someone starts experiencing symptoms of mental illness today, and guess when they receive their first intervention? On average, 11 years after the onset of symptoms. So in the future, we hope that we will be able to detect if someone would be high risk in struggling with a mental health condition before that condition happens, before the symptoms start. And through technologies like ours and many others that exist out there, obviously we're not the only ones that are tackling this issue. The goal would be that we provide preventative solutions. We detect that someone is in need to receive support, and we deliver proactive and preventive interventions personalized to the individual that could help them actually uh, escape from that particular path that we're taking these days. So what we've seen is that the personalization of interventions, first of all, leads to very high user engagement. What we see in other digital mental health solutions that do not have this great proximity to the user is that people don't use those solutions, and the reason is because those solutions are not effective. They don't know how the person feels right then and there, and they cannot support them right then and there. Also, what we see today is that individuals are left alone in between psychotherapy sessions or visits with a mental health coach or visits to a clinician. With solutions like ours, we could bridge that gap and provide support to individuals when they need it. So imagine next time that you're very stressed, that you receive a text message from your mental health coach or your therapist, asking you to checking in just to see if you are doing well and if they can support you in any way. From our perspective, this could definitely change the 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 path in terms of the mental health epidemic that we're experiencing right now, change the direction that we're going. And also from an employer perspective and from a payer perspective, I think that this would change significantly the cost of mental health that they can see today. So one statistic that people in the mental health space know very well, but it seems that no one else cares about it, is that people that suffer from a mental health condition, they cost their healthcare cost is 3 to 4 times higher than individuals that do not suffer from mental health condition. So this means that mental health is actually the biggest, the number one driver of cost of healthcare expenses in the US, not to mention productivity loss and anything else, hard dollars. This is because people, when they're experiencing a mental health condition, they visit the emergency room much more often. They go back to the hospital to receive support because they cannot get that level of support right then and there. So with those solutions that allow us to have this close proximity to the user, we believe that in the future, on the one hand, we will help individuals and alleviate this stress that they're experiencing. And on the other hand, we will support the healthcare system as well and reduce the overall cost of care for those individuals. And going back to what Alan was saying about diabetes as a proxy to the future of mental health, those things, what we are doing is not very different from what Livongo is doing or from what Hinge Health is doing in the MSK space. We combine continuous measurement or some type of objective data point with coaching and telehealth in order to support individuals 24/7. We have seen the engagement levels, the cost savings in those other disease areas, and trust me, those are going to be much more significant in the field of mental health.
Deb, just building on some of what George was just saying, the data around, the impact on employees that have mental health conditions versus those who don't. How are you seeing businesses prioritize both mental health, but also kind of, is there any increasing conversation about mental well-being during both this period, and this period in particular, when there's just so many things that businesses are needing to focus on in order to adapt to the world that we're living in now? And you're on mute.
Thank you. Yeah, I'm really encouraged by what I'm seeing in terms of mental health and prioritizing the benefits. I think it's become very clear that it's critical. And so anything that I've said here today starts with, you have to have a good, robust mental health care program, right? And from there, I think it's going to be showing the benefits of adding mental well-being as a population. Because if you think about the businesses that are going to survive and be successful out of COVID, people are the most, tangible and important assets. And we have access to the most powerful technology, which is our brains. But our brains are running on a program from thousands of years ago. So our phones are, mass destructions, weapons of mass destructions. Where, science is showing that on an average day, we have 60,000 thoughts, but 95% of those are the same ones we thought of yesterday. What am I going to wear? What am I going to eat? What do I have to do? Right. And so when I show that one slide of how our computer system, our brains are working, and that's the most tangible, important asset, that well-being conversation gets risen to the top, and the benefit then becomes very clear. So I think that is going to be the key to helping prioritize in the future. If anybody needs help, those are the statistics, along with the 600 research papers posted that go to support the additional elements of mental well-being.
The data that George mentioned also earlier about medical costs being so much higher with behavioral health costs, that's well known.
Yep.
The trick now, and we just don't have enough data points yet, is there with the newer ICD-10 codes, there's much more coding around social problems and what I'll call almost resiliency symptomatology in the Z codes, just to get into the inside baseball of it, clinical informatics. But people aren't using them enough yet, which is a problem. But when you do mine those codes and start to look at those as early indicators for behavioral health diseases and for cost implications, you find tremendous correlations, which I've been doing with some other work that I do. So the fact that your emotional well-being impacts on everything else is, for many of us, an accepted fact, but the proof when it comes to the financial correlation is now really rolling in.
It's really interesting. I mean, Deb, I'm a little discouraged that when I think I'm just having the same thoughts in my head as I did yesterday and the day before, that actually that's scientifically proven to be true. But anyway, George, this shift from, mental health, as kind of over the last number of years, as employers have really tried to help, employees with kind of severe mental challenges, to kind of broadening beyond that to really mental well-being and resilience. How are you seeing employers, that you're talking with? What does best in class look like?
Sure, absolutely. So what we see is that definitely there is significant progress, right? Even the introduction of applications like Calm or Headspace into employee benefits, definitely it's a very good sign, a very positive sign that employers are taking action. And those type of offerings when it comes to mental well-being are working well for some individuals, but there are many more that actually need another level of support. And basically what we see, and I think that Deb mentioned that before, we see either having solutions for people that are ill, and we have some solutions that are very basic, right? So meditation, for example, is really great. I meditate every day, but there is not, it's not something that can work for an individual that is suffering from intense stress, right? It could help, obviously, instead of nothing, but there needs to be an additional layer of support in between the two extremes, if you will, going from pharmacotherapy and talk therapy to meditation. There is a gap in between, I believe, and there needs to be additional solutions that will close that gap. Also, I wanted to mention that because in the US and globally, we face a significant shortage of therapists. I think that Alan mentioned that before. It's very unlikely that we will be able to scale the telehealth model without using any other technologies, right? So we can't have one psychotherapist for every person that is suffering from mental health condition, unfortunately. Even before the pandemic, we knew that 450 million people worldwide struggle with depression. So it's very unlikely that we will ever be able to train as many therapists or psychiatrists to support that increasing number of cases. So I think that employers, because employers are really the drivers of innovation when it comes to healthcare benefits. We saw that with Livongo. We saw that with many other companies. I believe that they should take the first step into innovating in the field of mental health and going beyond the traditional telehealth session over a video chat that exists today. And I think that having those solutions are a great step compared to where we were before. But I think that we need to move to the next level of innovation and use technologies like ours, like many others, that could help augment the powers of the psychotherapist. As we say, our goal is not to eliminate the psychotherapist by no means. It's a critical aspect of the treatment model, and the relationship between the individual and the therapist or the mental health coach is one that is driving the outcomes. But giving superpowers to the clinician, to the mental health coach, to the therapist through the data that we can collect through many sources, I think it's the way to go moving forward. To answer your question, I think that we see some promising steps forward when it comes to offering benefits related to mental health, a little bit less when it comes to mental well-being. But I think that we employers need to take the lead and innovate further, because sooner or later, the therapist networks are going to be out of capacity.
There's a few questions from the audience that I want to ask. And George, one person is asking about clinical trials of your solution. They're specifically wondering if you've done anything in the UK with the NHS, but just generally, can you talk about, what sort of clinical data you've accumulated using the FEEL approach?
Absolutely. So we have run clinical studies focusing on mild and moderate depression and anxiety over the past year. And what we saw in those clinical studies was an improvement in mental health outcomes north of 60% in depression and anxiety, 66% in depression, 64% in anxiety. Just to provide some comparison, some benchmark for those numbers, the standard of care, which is cognitive behavioral therapy with 60-minute visits with a psychotherapist, provides improvement close to 40%. So in our program, we provide only 15-minute sessions with the therapist. And although we reduced the duration of the session because we increased the frequency of the interventions because of the data that we were collecting, we were able to see 50% greater outcomes compared to traditional cognitive behavioral therapy. So that's a few of the data points that we've seen, but significant improvements in life satisfaction, in quality of life, close to 20%, and a significant higher engagement of users with their mental health.
Interesting. There's another question from a pharmacist wondering whether the pharmacist can get access to this data. Is it a service that's just contracted through employers? Is there a patient pay model? Talk a little bit about the business model that you have and how somebody, can I just load up this webinar and go buy one and start using it, or how does it work?
Absolutely. So right now, our programs are not available for a direct-to-consumer purchase. This is something that we're working with different partners into bridging that gap in the near future. So potentially, we might see solutions like ours in the pharmacy, together with medications for other conditions, or as a standalone mental well-being solutions. So I don't think that this is going to be too far away from now. But right now, we're offering our solutions primarily through health plans and life insurers in Europe, health plans in the US and life insurers in Europe. We recently started offering it through employers as well, both as an employee benefit as well as a solution for leadership coaching. As Deb mentioned before, we started working with a Big Four company in order to provide their solution as a development skill for their workforce. That's a very interesting use case going back to what Deb mentioned before. So right now through payers and employers primarily, but in the near future, we aim to provide our solution to consumers through different pharmacy chains or online.
60 seconds. Last question is from the audience. How does your technology deliver from heart math emotional coherence?
Quite different. So HeartMath is using a heart rate variability sensor. This is one of the 6 sensors that we have in our device. And the other important sensors that we have is an electrodermal activity sensor, a skin temperature sensor, and we have additional sensors that help us take the noise out of those signals. So basically, with our solution, we can detect your emotions when you are walking, when you are active out there. You don't have to stand still in order to monitor how you feel. And at the same time, if someone looks at the literature in the emotion recognition space, almost every study is using those 3 sensors that we're using. Heart rate variability alone is not enough in order to detect the emotional state of a person.
Well, thank you. I personally, I love technologies like this. I think there's just so many opportunities to capture data and analyze it and harness it in new ways to improve health. And this is a perfect example of how we can do that. George, thanks so much for joining us, and Deb and Alan for spending time and sharing your insights, and for everyone who joined us, thank you. We have a conversation, if you're interested in this topic, around how employers are utilizing innovative technologies. We have a program on November 18th where George had mentioned Livongo, so we'll have one of the founder of Livongo there, along with a couple of other people, to continue some of the aspects of this conversation. So thank you, everyone, and hope you have a terrific day.
Thank you so much.
Thank you.
Thank you.